Good morning, everyone. So today I will be discussing hypertension and two common drugs from two different classes that are used to treat hypertension. So what is blood pressure? So blood pressure is the amount of blood that your heart can pump with the amount of resistance from the arteries. The more blood that your heart pumps into narrower arteries, the higher the blood pressure that you'll have. So to be considered hypertensive, your blood pressure must be 130/80, according to the American Heart Association. So I will discuss two common medications that are used to treat it. So the first drug that I will go over is called lisinopril. So lisinopril is an ACE inhibitor, and it is the recommended first line of treatment option for most physicians to treat their patients. Lisinopril lowers the blood pressure by decreasing peripheral vascular resistance without increasing cardiac output, heart rate, or contractility. There are some common side effects to this medication, which may include a dry persistent cough, rash, fever, or hypotension. So another medication that is used to manage hypertension is nifedipine. So nifedipine belongs to the group of calcium channel blockers. How calcium channel blockers lower the blood pressure is they block the movement of calcium by binding to the L-type calcium channels into the heart. So what this does, it causes the vascular smooth muscle to relax, dilating the arterioles, which in the end decreases the blood pressure. Alright, so of course with medications you have to pay money. So when it comes to cost, the calcium channel blockers tend to be a little bit more expensive just because they aren't available in generic form. They can only be given in brand form. So of course to pay for a brand name you have to pay more money. However, the ACE inhibitors, they're cheaper because they are available in generic form. So patients are able to afford, ACE inhibitors a lot more often than they can afford calcium channel blockers, especially if they don't have any insurance. So on average, a person can spend roughly between $740 to $999 a year just on blood pressure medication alone. So both medications, as mentioned, they both are used to treat the hypertension, but they work differently. But in the end, their goal is to decrease the blood pressure, and as long as the patients are compliant with the medication, then they should have therapeutic results. As healthcare professionals, we need to ensure that our patients are educated on side effects, educated on the importance of taking the blood pressure medication. We should ensure that they do not stop the blood pressure medicine abruptly, because it can be harmful to them. And we just want to make sure that they are monitoring their blood pressure as well, and to notify their provider if they have any adverse effects. For example, like the dry persistent cough and the ACE inhibitor. Alright, you guys, of course there's, a ton of medications that are used out there to treat hypertension, but these are just two of the common ones that I discussed. So thank you guys for listening. Have a good day.